friends, welcome back to my YouTube channel. I'm Dr. Erin Davis, your new favorite soon-to-be periodontist. I cannot wait to stop saying soon-to-be because your girl graduates in like, I don't know, 130 something days. Yes, I Google it every other day. But anywho, I wanted to make a dedicated video about what being a periodontist means and just a little bit about my journey. People ask me all the time, and I've made several videos about it, but I feel like it's about time, especially since I'm in this era of wanting to rebrand, that I revisit that conversation, and especially since I'm on the brink of graduating. But before I go any further, make sure you subscribe to my YouTube channel, trying to grow over here, you know, and follow me across all social media platforms. Okay, let's just get into it. I was on the phone with my cousin the other day, and I realized, like, we were just having a conversation because he knows I'm about to move to Atlanta. And he's like, okay, so, you know, when you become a real dentist, will you be a, and I'm like, a real dentist? What am I now, you know? And I realized that a lot of my family and friends don't understand what I'm doing. To be honest, I feel like it took a couple times for me to explain it, like to my own husband, like the scope of what it means to be a specialist in dentistry. So I decided that I wanted to be a dentist at the age of 14, went to college, went to dental school for 4 years, right? Graduated dental school. Once I graduated dental school, I became a dentist. To be more specific, once I passed my board examinations and was licensed in the state, I became a practicing dental professional, right? So I practiced general dentistry for a year. Then, well, before then, when I was a junior in dental school, or a D3, I decided to choose perio as my specialty. Now that is a video in and of itself, and I'll probably talk about that next month, which is Gum Health Awareness Month. Ooh. Yes, this dentist is crazy about gums, where I'll talk about gum disease, what it means, what it looks like, all the things. But I chose perio in my 3rd year. I applied to perio my senior year. I did not match, which that again is another story for another day. Then I worked for a year, reapplied, and I matched into my current program, which is at the Dental College of Georgia. So periodontics is a dental specialty. It's roughly, I think perio was established as a specialty maybe like in the 1930s. So it's approaching 100 years of age. But essentially, our specialty's main goal is to save teeth, to save your natural teeth, right? And by doing so, we treat and we mitigate the effects of periodontal disease or gum disease, right? And just a small, really quick definition of what gum disease is, it's basically a chronic inflammatory response. So it's like your body is fighting against the bacteria in your mouth that happens in a susceptible host, is how we say it. So like in a person that is more prone for the body not to have a good response to combat its immune response, if that makes sense. Okay, that may have confused you. So let me put it like this. I have bacteria in my mouth right now. You have bacteria in your mouth right now, right? But our immune systems could be very different. My body can fight that bacteria and, you know, throw cells and things to it to break it down to where it won't destroy my tissue in my mouth. But in a certain person whose immune response is compromised due to a number of things, whether it be autoimmune disease or diabetes, or to someone who's a smoker, right? The body's response is not as effective, and that breakdown can result in bone loss and tooth mobility, and then ultimately loss of teeth, which is gum disease, right? So hopefully that makes sense, but I'll go into it in far more detail next month. Not as much detail as I'm inundated with on a day-to-day basis as a specialist, but enough for you to understand at home what gum disease is and why everybody doesn't have it. You know, I've seen patients who haven't been to the dentist in 25 years. They have plaque and calculus everywhere, no bone loss, right? Versus someone who has like a pretty good oral hygiene routine, but they just happen to have gum disease, right? So it's very interesting. Love my specialty, Zound boots, okay, as the young kids would say. But anywho, in order to be a periodontist, you have to complete a residency program. So I have a lot of close friends who are physicians, from dermatologists to emergency medicine to radiology to psychiatry, you know, all the things. I keep rich aunts and uncles around for my son, you know what I mean? But when they were in medical school, they decided I want to go into this specific specialty, and then they do a residency program, and then they in turn become that specialist. It's the same thing with dentistry. I decided I want to do perio. I'm now doing a residency program. Once I complete it, I'll be done. So I walk into every appointment and I am Dr. Davis, right? I sedate patients as Dr. Davis. And I've even had patients that I've seen them for a treatment plan, told them the surgery that I'm going to perform, and the day of surgery, they're still like, oh, you're the doctor? Yeah, I am. But anyway, that is what periodontics is. You specialize, and then moving forward, once I'm done with residency, my scope of practice will simply be periodontics. So you will not come to me for your veneers. Let's make that clear. You probably shouldn't be getting them anyway, but I'm not gonna get on my soapbox with that one. You won't come to me for your root canals. You will come to me if you need an implant, if you have gum disease, if you need a sinus lift, if you have gum recession. You feel what I'm cooking? If you need crown lengthening, you know, there's a certain set of procedures that we do and do really well that you are referred to a periodontist for. Next month, I'm gonna go into detail about gum health. So we all know what our gums are, right? They're the tissues that surround your teeth. They support your teeth in some ways. Basically, you know, your PDL, which is your periodontal ligament, which is an area it's my area of expertise. That's what anchors your teeth to bone. But the gums are a supportive structure. They can help as far as oral hygiene, and you want a certain quality of gum tissue, right? And in some people, your gums can be thicker, right? And in others, they can be thin. We'll talk about what that looks like a little bit next month. And then also patients can present with recession, which is basically your gums kind of running away from your tooth and exposing your root. And people that have recession also can tend to have sensitivity to like hot and cold foods, or it can be an aesthetic compromise. When they smile, they have these really long teeth. When they really don't, they just have more tooth structure showing. So as periodontists, we have a lot of different treatment modalities to address that. And I think the beauty of a specialty is finding out which recipe you want to use. You know, it's kind of like, I don't know, being like a seasoned football coach and then like knowing what play you want to play to get a certain outcome. So surgically, do I want to do a connective tissue graft? Do I want to use alloderm? Do I want to do this and then that? Do I want to use a laser or a scalpel? Like, you know, I'm really appreciating that as I'm on my way out of residency, the way that my thoughts have shifted, like the factors that I take into consideration a lot more as a specialist as it pertains to surgery, and really just the kind of type A way that I approach surgery now. Like I'm thinking from before I even pick the scalpel up, I want to think in my head, this is exactly how everything's going to go. And that was a big learning curve for me. It took me some time to kind of get there, and I'm still finding ways to refine that and get better at that. But yeah, essentially that's what we do. We do a lot in perio. I can't wait to like be free of the shackles of residency so I can like share cases, take you guys on a day. You know, at my new practice, I'm gonna, you know, hopefully have some type of social media consent. And if I have like a really cool case, I'll ask a patient like, would you be comfortable if I shared this case? You know, I don't have to share your face or anything unless you want me to. Because, you know, some people want, you know, they want to be tagged, and I feel it. But I've seen so many cool things, and I even talked to my friends and my peers, and they have no idea what I'm doing. You know, they're like, wait, you sedate people and do surgery at the same time? Yes, I do, and I do it really comfortably now, which is crazy. So I guess the 3 years was worth it. I don't know. We still have, that's still to be determined till my bank account says it's worth it. Okay, but yeah. I just wanted to make that video just to clear up what a periodontist is, give you guys some perspective on what my specialty does, and there will be more and more to come as the months go on. So if you have any questions about perio, if there's anything you want to see or learn or talk about, comment below because I need all the ideas. And hopefully next month sometime we'll kind of get into like my journey specifically in the perio and all the no's that got me here today. You know, sometimes the no's have more power than the yeses because it's how you respond and react post the no that truly defines you. You know, I hope that's a word for somebody today. Okay, well, that's the end of my video. I'll see you guys next time. Thanks for watching.